Executive summary presentation. Reducing patient falls in acute care settings using a predictive analysis dashboard by Jordan Brooks. There we go. I'm a level 3 MEPM student with a background in emergency medicine. I've been an EMT for about 4 years, and I teach BLS, CPR, first aid, AED on the side. So a lot of my framing comes from this experience with emergency medicine and interacting with critical care patients. But a lot of what I notice is that a lot of patients suffer from falls. Falls are a really common cause of preventable injury in the hospital as well, with the AHRQ reporting that nearly 1 million people fall in hospitals each year. This would take place in acute care settings, such as the ICU or ER, and would be implemented for patients at risk of falls, as in the elderly, frail, people experiencing a prolonged stay, post-surgical, any sort of mental deficiency or something like that. And all of this comes about because I witnessed a fall in the ICU during clinical shift. And I remember thinking, gosh, this was so preventable. This is easily something that, like, this didn't have to happen. Reducing falls can improve patient hospitalization and their health outcomes, and overall just improve the safety and their experience of their stay in the hospital. We can reduce falls by identifying risks and mitigating against them. Using a predictive analytics tool, we'll upload pertinent medical information to quantify the risks for falls. This data would include age, mobility, medications, mental status, and some other things as well. From there, we can get a number depicting how high of a risk this patient is. Once we've identified patients with an increased risk of fall, nurses can act to educate patients and their families to prevent falls. Cho et al. In 2021 conducted a study showing that predictive analytics tools can reduce fall-related incidents by up to 35% when integrated with clinical workflows and environmental alerts. So using the bed alarm and other things like that can reduce falls. Shore et al. 21 found that combining predictive models with visual alert systems improved timeliness of nursing response to high-risk patients. So by having a clear outline saying this patient is a high risk, nurses will be more responsive to that risk. And Jahangiri et al. In 23 emphasized that non-EHR-based tools, when properly integrated with nurse rounding protocols and interdisciplinary huddles, increased adherence to interventions and reduced falls. So by making sure that we're talking to the whole health team, we can all work together to help improve patient safety. Compiling the patient data into a predictive model will assess for the falls. But once the risk has been identified, mitigation can occur, such as bed alarms, grippy socks, the use of a bedpan, call light in reach, medical alert bracelets. Stakeholders for this include anybody who has an interest in reducing falls and increasing patient safety. This would be nurses, nurse leaders, patients, their family, the risk management department, physical therapists, and occupational therapists as well. The success of this intervention can be measured by a significant decrease in the number of falls and a decrease in adverse outcomes suffered from falls. You might be thinking to yourself, why does this matter? Why should I care? Well, if we can become the safest hospital for patients by reducing the number of falls suffered in the hospital, we'll have more patients wanting to come to us. Patients will be overall more satisfied with their care, and we can improve patients' health through all of these measures. In conclusion, falls are a significant source of preventable injury in patients. Predictive analysis can identify risks and mitigate against them. This is supported by evidence-based practice in reduction of falls, reduction of costs, and overall will improve patient safety. Here are my sources. Thank you.